Oh, whoops, there we go. Now my mic's working. All right, everyone, thanks for coming to learn about the CARES Fund today. This is something that uh, is not talked about very much. Like it's a newer fund. It's not talked about very much, but it could potentially impact you guys greatly as we are all getting a little bit older. So I am going to turn the time over to Logan, and he is going to give us the presentation. And so start jotting down your notes for any questions that may pop in your head to test Logan and his knowledge after his presentation. Thanks, Logan.
Yeah, no, thank you, Grace, so much for organizing this, and thank you for everybody that's attending today and investing your time into learning about this fund. For those, as Grace had mentioned, this fund really isn't known about too much. It has been coming out of your paycheck since 2023. So, as good Washington State citizens, we should be educated on what's being taken out of our paycheck and know what's going to and what resources we have available. So, I'm going to share my screen here and we'll cover a short presentation. And if you do have a question, just hold on to that question. More than likely, I'll answer it during this PowerPoint, but we'll open it up at the end for a quick Q&A session. And then hopefully this will be informative. So yeah, I'll just introduce myself here again. My name is Logan Sargent. I'm the outreach specialist for the WA Cares Fund at Aging and Long-Term Care of Eastern Washington. And today we're going to cover a short presentation on the WA Cares basics on what workers need to know. And so we'll start out by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with daily living of activities like bathing, eating, dressing, preparing meals, grocery shopping, and more. Long-term care does not include medical care like doctor's visits and treatments for medical conditions. Long-term care really covers a broad spectrum of needs and circumstances, also including for younger people who may become unexpectedly injured or become disabled or ill. And a lot of people don't realize how many different supports and services are included when we talk about long-term care. We often think of long-term care within a residential setting like a nursing home or assisted living facility, but can include care provided in your own home. In fact, most people long-term care needs can stay in their own home if they have the right supports in place. It's also very common for family caregivers to not realize that they themselves are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to and from appointments, make sure that she's all up to date with her medications, which are all common care activities. In fact, the majority of this type of care is provided on an informal basis, often unpaid care from a family member, friend, or a neighbor. Before we really dive into the program details here, I want to talk to you briefly about why this program is needed within the state of Washington. In short, the way that we've been paying for long-term care up till now simply is just not working. Studies show us that 70% of us will need long-term care at some point in time in our lives, and the majority of us just cannot afford it. The annual cost for 20 hours in-home care per week is around $36,000 per year, and other types of long-term care can even be more expensive, like a nursing home can be around $80 to $90,000 per year. Median household income for Washington State seniors is around $56,000 a year, and really, family caregivers have to step in to fill that financial gap, either with their own savings or providing unpaid care for a loved one. Almost half of caregivers reported a related financial setback, and they spend on average around 25% of their own income on care-related expenses. Many caregivers have to leave their workforce early to provide care. Caregivers 50 and older who do this lose on average of more than $300,000 in wages and benefits. The businesses and the economy are also impacted as well. Most caregivers work full time, and around 61% of working caregivers say that their care responsibilities impacted their job performance, often having to come in late, leave early, reduce hours at work, turn down promotions, or quit, retire early. When a working caregiver leaves their job, it can also cost around 1.5 times percent of their original salary to replace that individual. These challenges in mind and facing a projected doubling of the Medicaid LTSS cost by 2040, Washington State really sought to find a new solution and began a search in 2014 for a long-term care public policy innovation that would preserve, protect the Medicaid program budget, offer affordable LTSS insurance coverage, provide financial relief to middle-class families, and their caregivers, and also be financially viable and sustainable in the long run. The JLEC spent several years working with stakeholders, policy experts, actuaries, explore both private and public solutions. After much research on each of these approaches, the findings were very clear. A program like the Law Cares Fund that covers everyone, similar to Social Security and Medicare, is the only way to provide affordable coverage for all. We also know in universal coverage, where everyone participates in the program, is a best practice in a public pension, healthcare, and long-term care insurance program in capitalist countries throughout the world. And insurance programs can cover everyone at a low, stable rate, regardless of age, gender, or health status. That research and best practice in mind, in 2019, the legislature enacted the LTSS Trust Act, therefore creating the Law Cares Fund. You can see on the timeline here on the slide in 2021 and 2022, the legislature made improvements to the program's coverages and benefits. Workers began earning benefits in July of 2023. And this year, the legislature gave workers also the ability to take their benefits with them out of state as well. And in July of 2026, the benefits will become available for those that qualify. So let's talk briefly about how the Law Cares Fund can help. The Law Cares Fund is a universal long-term care program only in the state of Washington. It's a earned benefit, which means you contribute for a certain number of years to qualify for benefits. It's highly self-funded from workers' contributions, which go into a dedicated trust fund used only for this program. Workers will contribute 0.58% of every paycheck to the Law Cares Fund. You see what that looks like here on the slide. For a typical worker who makes around $50,000 a year, they would contribute around $290 each year, or around $24 a month into the fund. You only contribute while you're working. Contributions will stop if you retire or become unemployed. Everyone's covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there's no co-pays, no deductibles. You never need to file a claim or pay up front for services. This is what contributions will look like over the course of a typical career. You can see that $50,000 annual salary would be around $290 in contributions each year. It would total out around $8,700 over a period of 30 years. Almost all Washington State workers contribute to the Law Cares Fund. To determine whether someone counts as a Washington State worker, what we do is we look at whether their work is localized within the state of Washington. Determining whether work is localized in Washington can be a little complicated, but we use the same definition as the state's paid family and medical leave program, which gives us a really easy rule of thumb to work off of. If you are included in paid leave, you'll also be included in the Law Cares Fund, unless you have an exemption from the Employment Security Department. If you're not sure whether you participate in paid leave of the Law Cares Fund, you can just check your pay stub and see if you have that deduction there, or you can ask your employer for more information on this. If your work is not localized in the state of Washington, you're automatically not included in paid leave of the Law Cares Fund, so there's no need to file a Law Cares exemption. Federal employees are also automatically not included, and employees of tribes are only included if the tribe chooses the opt-in, and self-employed people are only included if they choose to opt in as well. Everyone who's contributing to the Law Cares Fund more than 500 hours per year is earning benefits. This even includes part-time, temporary workers. By contributing for a certain number of years, you'll earn access to this $36,500 benefit here. Now, this $36,500 will increase over time with inflation. So 20 years from now, it's projected to be around $60,000, $70,000. There are three pathways to meeting these contribution requirements. The first is what we call the lifetime access. This is the pathway that we expect the majority of Washington State workers to use to qualify for benefits. To utilize this pathway, workers must contribute for at least 10 years without a break or 5 or more consecutive years. This pathway will earn you access to that full benefit amount. The next is the early access, and this is for workers that have not yet earned the lifetime access but have a long-term care need while they're working. Say they have an accident, stroke, or injury, they can access this fund during their working years as well. To qualify for this pathway, you need to at least contribute to the fund for at least 3 years within the past 6 years at the time you apply for benefits. And then finally, we have a special pathway just for people that are near retirement age. If you're born before 1968 Therefore, you're near retirement. As the program begins, you'll be unlikely to qualify for that 10-year pathway. Instead, you'll earn 10% of the full benefit amount for each year you work. So, for example, if you work and contribute that 500 plus hours per year for 3 years, you'd earn 30% of the fund, just around $11,000. And that number will continue to be adjusted for inflation. Near retirees also have permanent access to whatever percentage of the benefit amount they earn at the time that they need care. They're also able to qualify through one of the other pathways if they choose to meet those requirements as well. Once workers meet contribution requirements, need help with at least 3 activities of daily living, they can get access to this 36.5 worth of services and supports. That is the lifetime benefit amount that will continue, as I mentioned, increase over time with inflation. With the Walk Cares Fund, workers really get the flexibility and the freedom to choose the services and the supports that meets their specific needs. This could mean in-home care, residential care, but can also include home modifications to make their homes safer, such as assistive technology devices, things like medication reminders, fall detection devices that can really help with some care needs. The Walk Cares Fund was really designed to help people age in place in their homes as long as possible. That's what the majority of us want to do, and we can do so if we have the right supports in place. Walk Cares Fund also has many options to provide support for family caregivers. You can choose someone who would be otherwise caring for you on an unpaid basis, get training as a caregiver, even be paid as a caregiver. This even includes your spouse. Walk Cares Fund can help lessen the impact on family caregivers by paying them directly for their time, making sure they can get other support services as well. We get this asked a lot, how far will this benefit go? $36,500 is just not a lot of money in today's society. Understand this will not cover 100% of costs for everyone, but it could cover the amount of in-home care that the average Medicaid client uses in roughly about a year. Studies show us that a third of people need care for just a year or less. And for those people, the Walk Cares Fund may be able to cover all the care that they need. And for others, really, the Walk Cares Fund provides the family with immediate relief at the time and really time to plan for future care costs. Here are a few examples how someone might utilize their benefit. They could pay a family member to care for them for about 10 hours per week for 2 years to get care supplies for around $33,500. Or they can choose services to help them stay safely in their own home. They can purchase $15,000 worth of home renovations, like bathroom modifications. They can get a wheelchair ramp installed, improve their home's accessibility. They can get an electric wheelchair or scooter and have meals delivered in for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury or illness could get 20 hours in-home care per week for a year, plus transportation to and from appointments and crutches for around $34,600. We also have some great news from this last session. The legislature passed a new law allowing people to take their Walk Cares benefit with them, even if they do move out of the state of Washington. So if you choose to retire in somewhere where it's a little warmer and sunny, you can now take that benefit with you across state lines. And under this new law, starting in July of 2026, Washington workers can also choose to continue in participating in the Walk Cares Fund, even if they do move out of state. To become an out-of-state participant, workers must have contributed to the Walk Cares Fund for at least 3 years, in which they worked at least that 500-hour per year requirement, must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. The state's in the process right now of making out-of-state participants a platform and program to report all their earnings and pay premiums as well, really with making it a focus easy for those participants. And benefits will be available for those out-of-state participants starting in July of 2030. At this time, I'll open up for any kind of questions that you might have. I don't know if there's any questions in the chat too. Feel free to drop those in the chat.
I have a quick question. So the 30 whatever thousand is your lifetime benefit. Is there like, do you have to use it within a certain amount of time, or just like you could use, 1,000 here, 1,000 there for the next, 10 years or whatever? And is there a time that you can that, like, do you have to be retired to start using it, or is there an age limit, or how do you establish whether or not you're able to use it?
No, no, great question. Say you have a long-term care need while you're working, you get in an accident and you have some long-term care needs. You can use half of that fund, during your working years. And say you retire, 20 years after you retire, you have another long-term care need, you can reuse the rest of that fund. And that money that was still allocated to you will continue to increase with inflation. So yeah, no, good question. There's no time limit, time frame where you have to use it. It's a benefit that you've been paying into an investment. Whenever you need it, you can access it. Yep.
And is there, Rosalind has a question, if you're going to send the slides to us, is that possible?
Sure. Yeah, I'll send them over to you, and if you wanted to kind
Okay,
of
and then
distribute
I can
that from there,
distribute. Yeah.
sure. Yeah.
And what does it look like, or I know people aren't using it yet, but what's the anticipated look like to get that reimbursement or to get that money?
Really, the benefit of this fund, it's unlike other insurance policies. Really, those funds are to be allocated as soon as that individual needs them. So the day that you get discharged from the hospital, the day that you have a long-term care need, you can get these funds allocated to you. This is by far, not the end-all be-all solution by any means. Really, what we're trying to do here is slap a Band-Aid on this, our current caregiver crisis that we're having, especially the states as a whole, but specifically in the state of Washington, and the challenges that we're facing in our healthcare system. This fund was really used created to combat those high prices of long-term care insurance, the increasingly high premiums. There's a whole lot of underwriting that goes in, make sure you're not covered. If you miss one of those premiums, you lose all your benefits. Really, this fund is, it's not going to cover everything for everybody, but it gives us a kind of a bedrock to build off of and access when we need care. Especially during our working years, we don't think about retirement sometimes, and let alone long-term care. But just having something available to us if something does happen during our working years is a great benefit. But great question. Any other questions?
What does must opt in within a year of leaving Washington mean? Yeah. So if you're leaving Washington, how do you opt in, or what does that mean?
Sure. Yeah. So say you change jobs and you move, let's say to Nebraska, take a job in Nebraska. If you want to keep paying into the fund and access that fund, you can now take that benefit with you all the way over to Nebraska. You just must opt into the fund again after leaving the state of Washington within a year.
Does that answer your question, Jennifer?
Can you hear me?
Yeah.
Okay, I think my question really was like, so if you do leave the state for another job or something like that, how would you keep paying into it?
Oh, great question. We're working on a online portal right now, and I apologize with my voice right now. I'm dealing with some type of head cold. Um, we are working on a portal right now to where this would be something that you can access on your phone, your laptop, and then it'll be all through the Employment Security Department, which will allow you to opt in via electronically. And it'll also show you how much you've paid into the fund, how much of the percentage of the fund you qualify for, X, Y, and Z. And they're currently working on that right now.
So I imagine that means that if you're going to a different state, like you yourself would have to pay, and it's not something that could be like a payroll deduction from your workplace. Like,
Yeah, I don't know how all that will. From my understanding, we're really building the plane as we're flying it here. It will be a payroll deduction that you can choose to have deducted from your payroll. But I don't know how that's going to look across state lines. But if I can do some research and digging, if I can find anything, I can send some updated information to you, Grace.
cool. Max is wondering, is it possible to draw on the Care Fund and Medicaid simultaneously?
Yes, correct. Yeah, this fund doesn't disqualify you from any other types of services.
And Rosalind's asking, is the benefit only available on a yearly basis / occurrence, i.e. if your illness is for 3 years?
Um, maybe to answer this question, hopefully this is answering your question here, but you can use whatever monies are allocated to you. You're really in control of how much you want to use, whether it's $15,000 or the full benefit amount. You can, depending on your care need, you can spend that all in home modifications or paying a caregiver. And that can be at different points in time in your, whether when you need long-term care, whether it's while you're working or years after you retire. Hopefully that answered your question there.
Did that answer your question, Rosalind? Got it. All right, cool.
Okay.
Any other questions? Well, thank you so much for taking time, especially while you're sick, Logan. We appreciate it. If you want to send
Yeah.
those slides out to me, I'll send them out to our staff, especially the ones here, but I'll probably just send them out to everybody also. So thank you so much.
No, thank you for having me, and thank you for everybody's participation in this, and I'll send those slides over to you all. If you do have any other further questions, you can check us out at wallcaresfund.wa.gov. Follow us on Facebook and LinkedIn as well. Thank you for all your time in this and all that you guys do. I appreciate it all.
Thank you.
Thanks again, Grace. Take care.
You too.